Greetings, everyone. We're going to give it a couple of minutes before we get started, but welcome. We're happy you could be here today. All right. All right, so let's go ahead and get started. We definitely have a lot to cover. We have some great panelists here today. We want to make sure we get through everything. Hello and happy Wednesday. My name is Katie Terry. And welcome to the School of the Global Health Management and Informatics Webinar Wednesday Summer Series. So I'm the communications coordinator for the school and your friendly webinar host for today. Thank you so much for joining us. We're super happy to have you. So a couple of housekeeping items before we get started. To our attendees, please be sure that you keep your microphones muted and your web cameras off. This is just so we can keep the focus on our panelists and the subject matter, and also to kind of protect your information. We will be taking questions from the audience, but we ask that you use the chat function to submit your questions directly to me via the private chat function, and then we're going to address them at the end during the open Q&A, okay? Please also remember that this is a live event. Do your due diligence to keep your personal information together. And for any current students, please be aware this is a UCF event, so all of the student code of conduct rules do apply. So that being said, today's focus with our Webinar Wednesday summer series is health administration, the business side of healthcare. The School of Global Health Management and Informatics does have 3 programs that focus on the health administration. So first, I'm going to go ahead and have our school program directors introduce themselves and their programs. Mark, would you please kick us off with a rundown of health administration and the undergraduate program?
Sure. I'm the program director of the HSA Health Service Administration undergrad program at University of Central Florida. I've been with UCF for about 5 years. My previous experience was about 25 years in hospitals, 20 of which I was in the C-suite as the CFO and CEO of 3 different hospitals. So I have the finance background and the operations background for running healthcare organizations. And our program is set up to be either online or face-to-face. You have the option of either. We have enough students that we can run every single class every semester. So the flexibility to get your degree in a timely fashion is really, really easy at UCF. And other than that, that's all I really can tell you, other than we have a great program and great faculty.
Thank you so much, Mark. And now Courtney and Don run our graduate level programs. Courtney, could you please introduce yourself and give us a quick explanation of the MHA program? And then Don, you go ahead after her and talk about the executive, please.
Sure. So my name is Courtney Nieves. I am the MHA program director. We are a CAMI accredited program, and we are one of the largest accredited programs right now in the United States. So we have roughly about 240 students enrolled in the MHA program currently. It is a business-focused degree teaching you about the business side, the management side of healthcare. So for any of you that are looking for a degree program and a master's program that's going to teach you to be an administrator in hospitals, long-term care facilities, pharmaceuticals, insurance companies, physician practices, this is the degree for you. So kind of like an MBA, but on steroids, drilled down to that healthcare administration level. So it's a great program to be a part of. We have a very diverse faculty and a very diverse student body that brings a very rich classroom environment. All of our classes are offered mixed mode here at our beautiful downtown campus, and we're very excited to all be back face-to-face here in the fall.
Don?
It's always that mute, unmute thing, you know? You'd think after a year and a half, I would have figured this out. I'm Dr. Dawn Ochin. I am a professor and the program director for the executive MHA program. I just want to give you a little background. I have been with UCF for 22 years. So I bleed black and gold. Apparently, I love these programs. I've been involved in every one here. The executive program is my latest adventure, and we cater to executives. We cater to those who have healthcare experience, who have management experience, 3 years or more, who are seeking to rise in their organizations into a higher level position. And we have around 130 students in our program. We're We have great small cohorts of 30 students or less. Students typically take 2 classes that are 4 credit hours each semester and graduate within 2 years. And we're happy to have you attending today.
Thank you, Dr. Ochin, and thank you to the other 2 program directors. They will be here to help us with questions during the Q&A. Now, it is my pleasure to introduce you our esteemed guests joining us on our panel. First, we have Natoya McGarrell. Ms. Natoya McGarrell, if I've mispronounced that, please correct me in a moment. She is the Strategic Account Manager with Natera Inc. and the Florida Chapter President of the National Association of Health Services Executives, or NACE. We also have Rhonda Hall, the Associate Chair, External Relations and Alumni Affairs at the University of Alabama at Birmingham's Department of Health Services Administration. And lastly, we have Matthew, or Matt Abene, who is not only an alumni from our program here at UCF, but also is the Improvement System Coach at Orlando Health, as well as an adjunct professor within our school. Welcome, panelists, and thank you again for taking the time to be here with us. I'm going to go ahead and start firing questions away, but please feel free to chime in if you would like to discuss. So first and foremost, Natoya, again, please let me know if I mispronounced that. You are the first statewide NACE president. Can you give us a quick rundown on NACE? I believe you just went through the 25th anniversary of the organization, correct?
Yes, that is very much so. And my name is actually Nataya, but I get Natoya a lot, so don't feel bad. So thank you, first of all, for the opportunity to speak with you all about NACE and what it is that the organization does and stands for. So NACE, the National Association of Health Services Executives, is a premier healthcare organization that's designed to promote Black healthcare leaders and also render accessible care to underserved communities. So we really focus on both building talented minority candidates to fill the pipeline of healthcare executives, while simultaneously bridging the gaps between all of the healthcare disparities that we are a lot of the times aware of, but more so with what's going on with the climate of COVID, revealing a lot of those disparities and allowing us an opportunity to bring some solutions to those impacted by them.
Excellent. Thank you so much. And it was Nataya, correct? Awesome. I'm going to make sure I get that right. So Nataya, please, what led you to your current role and career and president as the NACE? Like what made you go to the organization and how'd you get there?
I was actually voluntold, which I'm sure a lot of the individuals, both on the panel and probably on this call, can attest to with when you are driven to do things. So I have a servant personality, if you will. I like to help people. And when I'm a part of something, I don't like to just be just another member. I want to contribute. And so there were things that I saw that I wasn't really in alignment with, and I felt that there was some opportunity for advancement. And rather than talking about the problem, I wanted to be a part of the solution. So here I am.
That's excellent. Can you give us maybe what's been your most memorable moment since being a part of NACE?
Oh, wow. There's been so many. I will say I recently spearheaded when I entered my presidency term is 2 years. So with NACE, there's a 2-year term. My first year in, my primary focus was, we talk about promoting Black healthcare leaders, but as a larger organization, I really didn't see a lot of that. So for me, I wanted to really be able to demonstrate what it is that we say we do. So I spearheaded a NACE Stars development program, which is designed to develop competencies and skill sets of our members and then position them for open positions throughout the health ecosystem. But the most memorable or most impactful achievement within that is really just the feedback that I've gotten from the cohorts and the candidates within the cohorts and young professionals, directors plus, and mid-level careerists. We've placed individuals in positions, full-time positions, as well as internships, paid, non-paid, but just giving them the exposure that they wouldn't have necessarily gotten outside of being a part of the organization.
That's awesome. Thank you so much, Nataya. We'll actually touch a little bit more on that later in our conversation. That's excellent. I'm going to go ahead and switch over to Ms. Rhonda Hall. The healthcare management program at the University of Alabama at Birmingham is currently #1 in the US rankings. I hope that you are tremendously proud of yourself and the things that you and your colleagues have done. But can you tell us what led you down the Health Services Administration track? What made you decide that you wanted to teach our future healthcare leaders?
You bet. So yes, thank you for the invitation, and we feel very fortunate and humbled to be ranked. Just for those of you on the call, the rankings are based on visibility, and we'll continue to do what we've been doing for the last 57 years the same way, regardless of those rankings. It certainly we love it, we appreciate it, and have taken advantage of it. But it doesn't change the way we do things at UAB. It only helps, I guess, reinforce that we are all about improving and trying to make things better each and every year. So before I came to UAB, I actually went through the MSHA program, and we number our classes. So we have this kind of weird introduction, but I was in class 24, and now have admitted class 57. So I've been out for a while, but at UAB, we require the administrative residency. So I completed mine in Knoxville, Tennessee, and was there for 5 years in a not-for-profit health system, working in a number of management positions. And then a classmate of mine introduced me to my husband, and I moved to North Carolina, where I ran a group practice in Pinehurst, North Carolina, for a little bit over a year. And one of our faculty members, which Dr. Ochin knows well, Dr. Howard Hauser, always preaches, and y'all may have someone there that does this, but he always talked about having your go to hell money. And excuse my French, but that is so that if you ever get fired, or if you're asked to do something that you can't in your values do, then you've got money set aside to be able to either weather the unemployment, or be able to not have to work for a little bit. And so I actually then worked for the Quality Improvement Organization of North and South Carolina. And with that, I worked with both hospitals and group practices. And now, almost 20 years later, we had built our family by adopting our first son, Peyton, from Romania. And we wanted to be closer to family and friends. And so my husband and I looked to see who could find the job first. And I happened to make a connection and was able to find a job at the university working directly with the MSHA program. And I did operational roles primarily there. I have taught a little bit group practice, as well as we instituted the internship about 15 years ago, and I helped get that going. But we have always at UAB required the administrative residency as a component of the curriculum. So I was always involved in the operations of that. And now my role is I've moved more to a departmental role and work with our alumni, which across all of the different programs we have: informatics, healthcare quality and safety, our undergraduate in healthcare management, as well as our master's in both a residential and executive, as well as our doctoral programs, of which Dr. Ochin is a graduate. And we have an executive doctoral program as well, which is designed similar to your executive MHA. We have one of those as well, but it also, there's a doctoral program that is focused on working healthcare professionals. So with that, I love UAB. I love my time here. So it was an easy sell for me to recruit students, and all of those students that I helped recruit for the first 15 years of my time here at UAB are now alums, and now I get to call on them to help in a number of different ways, whether it's serving as webinar panelists like today for our department, or internship preceptors or residency preceptors, as well as guest lecturers and applied projects. So does that, I hope that gives you a background.
No, yeah, definitely. It leads me back into like the academic side of things, and I'm going to take that side of it, talking about students, and talk to Matt. So Matt, you were actually the second alumni spotlight that I did after starting my role here in HMI. And I remember thinking that this guy was serious about making his path rather than following one. Can you give us a little tidbit about how you found your way into the industry?
Sure. Thank you for that compliment, by the way. So I was raised by my mother as a nurse. So growing up, it wasn't what industry I was going to end up. It was kind of where in that industry I was going to land. Clinical and nursing wasn't quite for me. So I transitioned into where I felt I could have a larger impact in healthcare administration. Received an undergraduate degree from UCF in healthcare administration. Kind of had a hard time initially after school getting a job. Kind of had to start at the very bottom. So I started in an internship after 3 years post-graduation, moving into a transportation role after that. So literally with a bachelor's degree, pushing patients around the hospital in wheelchairs. I felt like that first role really pushed me to drive myself to be better. I kind of quickly promoted throughout the upcoming years. And decided it was time for grad school. I will confess I wasn't the very best undergrad student. So when I went to grad school, I told myself I was going to 100% commit to that program. I felt like I really did that. I kind of went all in on student organizations. I was president of a honor society for the HSA program. Kind of very involved in the ACHE, American College of Healthcare Executives, as a student member, and just really pushed myself to, get out of my comfort zone, work hard, get everything I could out of the program. It was a really great program, and I, committed up front that I was going to not be that undergrad Matt that I was, and really push myself.
That's excellent. And you definitely, everyone in our department remembers you, not just because you're an adjunct in our program. Speaking of, making that growth and moving your way up in the industry, can you give us a quick day-to-day, what it's like in your current role at Orlando Health?
Sure. The work that I do is it's improvement work, process improvement, quality improvement, kind of has a bunch of different names. Here at Orlando Health, we call it an improvement system. So we take a systematic approach to improvement. But really my day-to-day, what I love about my job is every day is a little bit different. I kind of have my hand in a few different areas. I help out with data analytics. I help out with kind of project management, but most importantly, and what I'm most passionate about is the improvement projects that I get to help through facilitation, working with frontline staff leadership, kind of bridging that gap, helping execute the organization's strategy. What our organization deems necessary for the fiscal year, what we're going to focus on are strategic imperatives, taking that, rolling that out with a group of kind of frontline management paired with executive leadership, and work our hardest to accomplish those goals. As an example, one of our goals this fiscal year is to reduce our hospital-wide readmissions. So that's been something we've been very focused on, our 30-day readmission. So we've done a lot of work to get that ball rolling. There was a lot already up and running, but we've made a lot of improvement over the past year as well.
That's awesome. Well, your organization is making a lot of improvement like you did from transport to now in strategic planning. So that's awesome. Natalia, you're in the industry as well. How about life over there at Natera? As a clinical genetic testing organization, how does your health administration or management background play in your day-to-day?
Oh, it is every day, really. So my role as a strategic business account manager is to really market development. So I remove the obstacles that these field sales team face in trying to access these large systems, such as Orlando Health. So I cover all of Florida, some of Alabama, and some of Georgia, just those southern tips of those states. And really what it is just being able to leverage strategy and look at various components that would allow Natera to align systematically with some of these systems, such as Orlando Health, within various categories that we support, which would be women's health, oncology, and transplant.
Gotcha. Thanks so much. So just to show kind of the growth to our attendees and prospective students, our current students, I want to take a quick second and rewind for everyone, including our program directors. And real briefly, can everybody just tell me, what was your first job after college? Let's go ahead and start with Courtney or Dr. Nieves.
Oh, first job. Actually, initially I was continuing because I was selling cars and doing finance for a car dealership, which is completely out of the realm of anything healthcare related. I realized that didn't want to do that for the rest of my life. So I started the master's program where I got to be Dr. Ochen's GTA all through the master's program, which led me to my first healthcare job, which was in healthcare marketing. I was a marketing manager for a brand new healthcare startup, which was really exciting. And I covered pretty much all of Central Florida. And that was my first job in the industry. It was really a lot of fun.
Well, I really like that. You went from car sales to then healthcare marketing. That's a big leap. Dr. Ocean, since she was your GTA, what was your first job after graduating college? Like actual first job, not necessarily in healthcare.
You are making me think way, way, way back.
She was older.
Oh my. Actually, I similar to Matt, I grew up in a family of healthcare workers, a physician, a nurse, and it was determined that I was going to go into healthcare of some sort. I'm not a blood and guts kind of person, so I went the medical records route, and I got my degree in health, what's now known as health informatics and information management. So with my undergraduate degree, I had spent a lot of time in our hospital at Medical University of South Carolina, just growing up there with my parents. I had an in because of that. And I got a really nice first job. It was working in quality, risk, and utilization management. And I worked with the surgery, orthopedic, and urology departments. And it was the coolest job ever because I got to take all the things that I learned and be on the floor in the unit, go to M&M meetings, morbidity or mortality meetings with the physicians and the residents. And I got to go to the OR and observe. I did really, really cool things. And it was kind of like Grey's Anatomy, those things, it's really like that. So it was quite a learning experience. I loved working in hospitals. I loved working in healthcare. And I love that I can look back on that experience so long ago and bring it into my classroom and share it with my students. I think that's really cool to be able to do that.
And now Dr. Ocean is a program director, so quite a leap.
Yeah.
What about you? What was your first job?
Cool.
Natalia?
Sorry, I didn't hear my name.
No worries.
Actually, I have always been on the commercial side of healthcare. Directly out of college, I was hired by Johnson & Johnson in their medical device division. And I would kind of say I got stuck on this side, but I actually love it because it gives me an opportunity to see healthcare through different lenses. And it allows me to support it on various facets, but still driving efficiency and leadership and just everything healthcare related. So I like the flexibility that it offers.
Awesome. So piggybacking off of, going from college into the career field, Rhonda, do you recall what was the biggest challenge when you went from college to career path?
Let's see. Well, I thought I went to undergrad. I worked in the pharmacy in high school, and the pharmacist thought I should go to medical school. So that's what I thought. And my freshman year at Alabama, I took zoology and made a C in it. And I was thankful to get a C. So I was like, I don't think that's my route. And so I ended up doing an internship as an undergraduate in healthcare management in Mobile at the infirmary. And I knew then that I wanted to do this for sure. And so I went, straight to graduate school. Well, actually I had about a 9-month stint at a Catholic hospital in my hometown of Gadsden and loved it. I thought I had an undergraduate degree and I thought I knew a lot about healthcare, but I got to my first job and I was like, heck, I don't really even understand the difference between Medicare and Medicaid until I worked for this senior program where I was recruiting senior adults into a program that our hospital hosted. And I had to really quickly get to understand the difference between Medicare and Medicaid in real life. So that might have been one of my first ahas of like, I didn't know everything for sure. And then going to graduate school, you know, given that I had an undergraduate in healthcare management, I thought, well, this will be a piece of cake. And I think we covered more in the first quarter. We were on quarters then than I had like in 2 years of my undergraduate. So it was a lot more reading and stuff. And then the other aha is like I guess a different, you know, realization is working with people every day that have different kind of ideas about what work really is. That was hard for me as a young manager, managing my first group of people that were twice my age, and that was a big adjustment. And you know what I found is that if you just respect people and listen, because as a young, you know, coming out of graduate school with a, you know, being less than 25. Give a lot to learn from the people that are in the field. So I think if a lesson I learned was, you know, listen to what the folks that have been there for 20 and 25 years, listen to them, and you'll have some new ideas that you can actually share with them based on kind of your new eyes to the same old problems. But certainly appreciate and respect the backgrounds and experiences they provide and you can learn from.
That's great advice, Rhonda. You know, speaking of essentially learning from that, you are also the chair of the National UAB Health Administration Case Competition. Another opportunity for students to learn some of this professionalism, what it's like in the healthcare, et cetera. Can you tell us quickly about the case competition, what it looks like?
Of course, I love talking about the case competition. We have finished 15 years of it, so we're preparing for our 16th. We did go virtual last year. University of Central Florida has participated in 13 of the 15 case competitions, so they have a long track record of working and participating, and actually won second place in 2011. As Dr. Ochin remembers, I'm sure very fondly. We are fortunate to be able to find topics each year that are real issues that are going on in the healthcare industry. And we invite CAMI accredited programs. And those of you who are prospective students, I would really encourage you. There's a lot of programs out there that offer similar things, but the gold standard is CAMI, and that's our accrediting agency. And we limit it to the CAMI accredited programs. And similar to NACI, you know, you have teams of, you know, 1 to 3, typically it's 3 students who get the case about 3 weeks ahead, and they spend probably 120 hours over that 3-week period coming up with solutions for a case that's, you know, an issue that's really impacting an organization. And they actually get to present their ideas to executives. It's not faculty members, but it's executives in the industry across the country who may have a background in the content area that we're having the students and the teams assess and make recommendations on. And usually in the final round, we actually have at least 1 or 2 people from the organization where you actually are presenting to the people who will actually probably take your recommendations and implement them in their organization. And we try to, you know, vary it from what I like to call blocking and tackling cases, which are really help, you know, operations in really pretty deep dives into operations. We also try to do some strategic initiative type cases. So from looking at, you know, the time in the emergency room delivery to mental health cases to looking at group affiliations, physician affiliations. One year the case looked at actually coming up with plans on how do you implement a population health strategy for Ochsner Healthcare, and then a number. We've been fortunate. Last year the case was in Miami on a pediatric, which we hadn't done before, but except for the very first year, there was a pediatric case, a group practice in an area in Miami that needed a post-pandemic operational plan, and that was very operational. So we try to keep the content something relevant that students will go out and possibly utilize when they go into their residency or fellowship or their first job, as well as allow networking among other students who are in graduate school, as well as these healthcare executives, which you can learn a lot from.
Thank you so much, Randa. Natalia, I believe NACI has something similar, correct?
Me too.
What would you say is the most beneficial part to some of these programs for students to take part in?
No, to echo all of what Ms. Rhonda just shared, yes, I believe the competitions in general, be it at Ms. Rhonda's site, NACI, or any other organization that facilitates them, I would encourage each and everyone to take advantage of them because it really gives you real life opportunities to work on issues that some of the systems are facing. I know with NACI, we usually provide access to the corporate team that the issue would be impacting. So the groups would have access to the CEO, the CFOs, the nurses to really ask questions and to uncover some of the challenges and the roadblocks that are preventing them from moving forward with whatever that challenge is. And just that contact and to have access to those individuals alone, I think is beneficial to the individuals that are participating in the competitions.
Yeah, for sure. Thank you so much.
Could I add in just that, NACI is the first real case competition. It's been around, I think, 26 years. We were kind of next in the game, but now I'm actually trying to write a paper on this. There are over 25 case competitions now, and depending on what your interest area is, there's a competition for it. It's data analytics, operations, quantitative or finance. I mean, there are informatics. There's one for pretty much every component of healthcare. So I would encourage any of you just to really participate, because it really is an amazing learning experience for everyone.
For sure. Speaking of that, Matt, I believe you either worked with or were actually on the case competition team when you were in graduate program, correct?
Correct. Yes. So I
go
mentioned
ahead and give us a quick rundown. What was it like from the student experience and what you learned from it?
Yeah. So I mentioned earlier, when I went into the grad program, I was going to really dive in. And when I was approached about the NACI case competition, I had no idea what it was, no idea what I was getting myself into. But I said, of course, I'll do it. And quickly found out it's a semester or more worth of work in just a couple of weeks. Very intense. Great learning experience. Really got to partner with my colleagues in the program and bounce ideas off of each other. We had 4 different people, very different approaches to things. We had 3 that presented in the case competition. Just an incredible experience. And then when I heard about the UAB case competition the following semester, without remembering how much work it was, said, I want to do that. And I jumped right back into it and quickly, found out, yes, this is a semester or more's worth of work in a few weeks. But I was fortunate to captain our case competition team for the UAB. I think aside from the learning experience, one of the big takeaways for me was the networking aspect, that you got to meet people from programs all around the nation. People I still keep in contact with on LinkedIn, always getting to see those people getting promotions and staying in contact with them. So, for me, networking is a very important aspect of how you get a job, how you grow your career. So when I went to these case competitions, I made sure to network with my peers that I knew at some point are going to be executives in the future. So just all around great experience. Like I said, a lot of work, but well worth it in the end. And getting to present to executives and hearing executives critique your ideas or ask questions and, give you great feedback or maybe not so great feedback sometimes. It's just an experience that you can't get without, being a high-level executive or consultant in the healthcare world.
That's super great. I'm so glad that we have 3 people here that can give us each level of the perspective for these types of events. Dr. Nieves, you work very closely with our students when they do the case competitions. What would be your advice to undergraduate students or graduate students that want to get on the team and want to do one of these competitions?
Well, to echo my colleague's comments, it's an amazing opportunity. And like Matt said, it is a lot of work, but it's very, very rewarding. So although you're not getting college credit for it, you're not getting paid for it, what you get out of it is just immeasurable. And you're going to get out of it what you put into it. So if you put in the time, you put in the effort, you're going to not only learn these real world healthcare skills that you need to be successful in the industry, but you're going to be able to network with other colleagues, other peers, and other programs, other industry professionals, to really make your mark. And one of the most impressive things that I remember is I was fortunate enough to not only be a part of the UAB case team as well as a NASI case team, but taking a team to NASI when we had, I believe it was in Orlando actually, so we were very fortunate, it was very close. And our team went and they just absolutely embraced everything that it had to offer. And even though we didn't make it to the finals, they weren't upset about that at all. They just took it for what it was, as a great learning experience, and then threw themselves into networking. And by the end of the actual conference, all 3 students had multiple interviews with fellowship sites right there on site. Some of them fellowship sites they hadn't even applied to. And ultimately, all 3 of them ended up with fellowships. One of our team members actually ended up with 5 offers and came to my office and said, I don't know what to do. I've got a problem. And I said, okay, let me know. He said, I have 5 offers. What do I do? I said, that's a great problem to have. And he just kind of weighed the pros and cons and really thought about which he would be most successful at. And all of them are now incredibly successful, have finished their fellowships, and have director level roles within those organizations. So it's an amazing opportunity. Again, lots of work, but so very, very rewarding.
Yeah, definitely. Just to get somebody's perspective, Dr. Bush, I know that you have some history in the industry at a pretty high level. From your perspective, from being an actual hospital facility administrator, what's your thoughts on these case competitions and what it can do for students in their career?
Well, I've been a part of some of the case teams as well. And really what it does is it gives them a chance to work on their professionalism, work on their networking skills, and just be able to start to think critically and look at real problems that are happening. The beauty of these case competitions are these are real situations. These are something that's trying to be resolved somewhere currently, or was resolved recently. And so the beauty of these cases is the ability for students to start to think critically, understand that there's different ways to look at problems. How do you address those problems? And welcome to the real world. You run into these every single day. You have to figure out how to address them. You have to figure out quickly what you're going to do. And you always have to have a plan A, B, and C, because it's never going to go exactly the way you want it to. And when you're doing these case competitions, you need to do the exact same thing. And so it's really building a lot of skill sets that you're going to use going forward. Now, it's a real compressed process. But again, it's a skill set that you're going to always use as an executive. You're always looking at problems that come up, the short-term solution, the long-term solution. What do I do now? What do I do 5 years from now? What do I do 5 weeks from now? And what happens when things get into the way of that? And these case competitions offer great opportunities for students to learn, to network, and to see how other people handle problems and to think differently. I think that's the best thing about it. It's a great critical thinking exercise. Yeah,
definitely. Thank you for that perspective. Dr. Ochin, I know you work closely with individuals that are already in the industry. Our executive program does cater to those that, have already been working in the health administration field or have been clinical and are working over to move to the administration side. How do you think your students or executive students could get involved with case competitions or be more involved with the ACHE or NASI, et cetera, so that they could be a part of this?
Well, that's a great question, and one that our students don't automatically think, oh, we could do these things. They're just for the traditional track. But we are one program or one MHA program with 2 tracks. everything that we offer to our traditional students, we offer to our executive students as well. So if a student in the executive program track came to me, or Hannah, who's our program assistant, and said, I'm really interested in participating, we would have them audition, just like our traditional students do, to see what they might bring to a team. And we could potentially have a team that had mixed students from each track. We do have the same funding available to send our students to these competitions. And we really look forward to the day that our executive students want to do that. Many of our executive students, they're in high level positions. They're all over the world. They're very busy, and even the 2 classes that they take, that's keeping them even busier. So we haven't had a lot of interest, but I see that changing in the future as they get word out about how wonderful these opportunities are and how it opens further doors in their career. With regard to mentoring, I see that our executive students could serve as excellent mentors to our traditional track students as well. And we'd like to see a way to bridge that so that they could work together in more areas, on more projects, and on things like the case competition team.
Definitely. What we can do is get some of those high-level executives to contact Ms. Randa Hall and give them some of the problems they need solved, and we can work it around that way.
Love it.
It's super excellent. All right, so I want to go ahead and transition over into our open Q&A. So you won't get me asking questions anymore. We're going to open it up to all of our audience. Everyone that's watching and listening, if you have a question for one of our panelists or our program directors, please utilize the chat function. Just type up your question and I'll go ahead and fire it at the panelists. I do have a couple of questions just for you guys in general about, the health administration field that you could be thinking about while we wait for some of our audience to ask questions is, what do you think the biggest challenge facing health administrators, today? And don't answer these right away, but we'll touch on them. But think about, what's one of the biggest challenges facing health administrators today as, students move into their careers moving forward? And, the one sentence piece of advice that you think could just carry across. I do have someone typing up a question really quickly. I think they hit enter. There it is. For Ms. Randa, what department are you most proud of at UAB?
But the Department of Health Services Administration, the one I work for. I've worked across the campus with different places, but our department is really unique and has a lot of amazing faculty and staff, and always trying to push the envelope in how to deliver the best educational experience and train the future healthcare leaders.
Excellent. So Matt, I'm going to start with you with the questions that I mentioned. What do you think is the biggest challenge facing our, soon-to-be graduates going into the career field?
So probably the same challenges that have been faced, for years past. Is just healthcare is constantly changing from year over year, month over month. So the ability to be flexible and adaptable is something definitely needed as a healthcare leader. If you can't get in that mindset of this is the one way that things need to be done, and this is the one approach that we can have to fix it. It's all about bringing in new ideas. A lot of, at least in the hospital level, a lot of the initiatives are driven by CMS or federally. So it's just kind of adapting to what's coming, and what's the best approach that we can take to meet the needs of the communities and meet the needs of the new the federal I can't think of the word, I'm sorry, regulations. So I think that's the ability to adapt and just being able to adjust to change. And then my kind of one sentence piece of advice is something that Reed gave to me when I was a graduate student, and he came and spoke at one of the student organizations that I mentioned I was president of, and he didn't necessarily single out and say, Matt, this is for you, but something I really took home. Just a quick one, network or no work. And I know I've kind of mentioned it already. Networking is really important. It's really important early in your career. It's really important middle of career, senior career. It's just such an important aspect. I didn't get to answer the first question or the first job out of college. So my first job out of college, sadly, was waiting tables and bartending, which at the time I felt woe was me, but looking back, that I think that really grew that skill of networking, being able to talk to anybody, people that are upset about food and drinks, come in and sit and talk to you. So I felt like, being able to take that skill and network, and that's something I push as a adjunct instructor. I talk to my students about, give them kind of professional advice. It's my very first lecture is all about networking and how important I think that is.
I'm glad you mentioned that. That's why I asked the question of, what was your first job? Because I think it's really important for a lot of students to see that, like, no matter where you are right now, as long as you do the work, you will make it to where you want to be. And, just like you said, you were looking, when you were in it, you were like, woe is me, I'm waiting tables. But then you look back on it, and it gave you the flexibility, it gave you the income, and it got you that customer service ability to network with people. So definitely, thank you for mentioning that. Right, we have a couple questions rolling in. So we have one. I was originally interested in nursing, and unfortunately, I wasn't accepted into the program. My advisor recommended health service administration and pursuing nursing school afterwards. Would this program be fitting for me? So I'll go ahead and answer that one really quickly. Tori, we do have, just as Ms. Randa had mentioned, she was thinking about the medical, and they had talked about, oh, well, you should go into pharmacy, et cetera. But she was like, no, I didn't want to do that. And as well as Dr. Ochin, her family were very clinical side of things. And she was like, I don't like blood and guts. I don't want to deal with that. And we do have a large chunk of our students who either start out wanting to do healthcare on the clinical side, or their families were, and they find out, you know what, I want to work in healthcare, but I want to do it on the business side. And then there are some that go back and forth between the two. So Dr. Ochin, as we mentioned earlier, she's a part of the executive program. A lot of people who end up going into the administrative side are clinicians that have been nurses and doctors and CNAs, et cetera, who decided they wanted to take their clinical expertise and move over to the administration side, and vice versa. Our next question is, what clubs or groups offered at UCF can help me be a more desirable applicant for jobs upon graduating the MHA program? So I'm going to go ahead and let Dr. Nieves and Dr. Bush answer that question. Dr. Nieves?
Sure. So really, it's not necessarily about the clubs that you join. It's about what you actually do in the clubs. So you could join 12 different clubs and just be a member and go to meetings and do pretty much nothing except be a member. And while you'll get some good exposure to different things, to me, it's better if you maybe pick 2 or 3 and kind of go all in. So maybe join NACI or join ACHE or join the Graduate Health Network, which we have here at UCF and the MHA program. If you do that, then seek out a leadership role or seek out a committee role so that you can have something tangible to put on your resume. So it's not just, I joined 12 clubs and I was a member, it's, I was a member of UPD and I was the president. So that shows some leadership capabilities. It's really how you frame it and what you make of it, not necessarily quantity, but the quality of what you do.
Dr. Bush, you have anything to add? Oh, I think we lost your sound, Dr. Bush.
My recommendation would be join one other club, try to be in that leadership position, but make sure you belong to ACHE. That's where you're going to network. That's where you're going to see healthcare executives on a regular basis. I know we have students all over the state, all over the United States, but those in Central Florida, if they're a part of the Central Florida chapter, they will have a great experience because it's one of the most active chapters I've seen. You have a great opportunity to do networking. You have a great opportunity to talk to people who are working in the healthcare field. And that's the way you're going to get your job. It's not by sending your resume, but by having a contact somewhere. And the only way you're going to get those contacts is to meet people. And that is a great organization to do that with. And the other good part, and I'm not getting paid for this promotion, but the other great part is it's only $75 as a student. And when you get out of school, it's a lot more money than that to belong to ACHE. So from my perspective, it's one of the best deals in town.
Thanks, Mark. This question is for Matt. What are some goals for long-term care at Orlando Health?
I'll be brief with this one. So, post-acute care is really important, especially after that acute care setting. Orlando Health does not currently have any long-term care facilities of their own. That's kind of been in conversations of, do we create our own? Do we, or do we just seek better alignment with those available in our communities? I mentioned 30-day readmissions as something we're really focusing on this fiscal year, and that's the partnerships we've made with our long-term care facilities has been really helpful in those reducing those hospital-wide readmissions. And then as far as length of stay, it's really been a good partnership as well, getting those patients out of our hospital, not as quickly as possible so that they're still sick, but so that we can get them to the right level of care and get the next patient to the acute care setting that they're in need of. Those partnerships with long-term care are incredibly valuable.
Thank you so much, Matt. So we'll do this one last question. Natalia, I want to go ahead and ask this one to you. What are some tips or your advice to pinpoint what you want to do in your career, especially since health administration is so broad?
Well, my response is going to be a bit different, I believe, from any of the other panelists because I'm a bit biased, right? Because I'm not in the hospital, my go-to isn't focused on the hospital and various aspects within the hospital, because healthcare is such a broad, like you said, discipline that has arms that reaches so far outside the hospital, but still impacts the hospital. So you have payers, you have, like I said, the commercial side, which I'm on, you have the actual hospital, and there's a variety of others that you can, the list goes on and on and on. So I will say first identify what interests you. Right. If it's patient care, then obviously you want to go in to the bedside and then advance that way. And to Katie's point, get into administrations from that leg. But if you want to do administration and still influence the hospital, the commercial side does a really good job in doing that. The payer side does that as well. Matt mentioned CMS, Center for Medicare and Medicaid Services, which really dominates and dictates everything that's done within the hospital from a payer standpoint. So, I mean, it really depends on what interests you, and start there and you'll be able to move.
Thank you so much, Natalia. You said that yours might be different, but I think it's really important because a lot of our students forget that there's more to healthcare than just a hospital. There's more to healthcare than just these healthcare facilities. So your perspective is absolutely appreciated because, we all do want to know about that. So that's going to wrap it up for us today. I want to take a quick second and to thank all of our panelists, our program directors, Randa, Natalia, and Matt. You guys are wonderful. This was super great and informative. Thank you so much for being here. And thank you to all of our attendees for coming today. I'm going to go ahead and put up this next slide. We are doing our summer webinar series for the next few weeks. So we'll have a couple of other subjects that come up with different panelists. Next week is our health informatics and information management focus. So a couple of us have touched on it a little bit on the side about how there is that other side of the health administration that covers that, business operations when it comes to health medical records, all of that. So please feel free, visit our website, give us a shout if you want more information, and definitely follow us on social media. Thank you everyone for joining, and I hope you all have a wonderful day. Bye-bye.
Thank you for having me.
Thank you.